or Eileen, I think Eileen's on the recording glitch, on the recording tip. So this session is now being recorded.
Am I doing the recording? Sorry.
You're doing the recording, yeah.
I don't have a record button.
So I'm recording, don't worry.
Thank you. All right, fabulous.
Sorry.
Oh my gosh, it's one of those days, and I hope you'll just understand that it's one of those moments. So do forgive us, and we'll do everything we can to make sure it doesn't happen again. So, Eileen Amber, can I invite you to bring up the presentation as well, please? So welcome everybody to the COVID Champions Forum. It is wonderful to see those of you who have managed to get in, and hello and welcome to our guest speakers as well. Thank you for joining us and bearing with us and being so very patient. Great to see you, great to have you all here. So we are the Torbay COVID Champions Network and Forum. There's around 250 of us in total now. We usually get between, I don't know, 15 and 30 people join us on any one forum session. I think it's going to be a bit reduced today because of our technical hitch. So Ahmed, Carol, Julia, Letitia, we're going to ask you to pipe up for everybody and all the questions that you think might be asked. And hopefully it will just mean a really good discussion between us all. So, right, let's see where the presentation, let me pull the presentation up. Do forgive me. Oh my goodness, it's one of those days, isn't it? Best laid plans and all that.
Don't worry, happens all the time.
Yeah, we're just going to roll with it. We're just going to roll with it. It's like live TV, but more frightening when...
We're flexible and agile in Torbay, aren't we?
It's actually very, and there'll be no Piers Morgans. I'll be stomping off anywhere. I'm going to stick with you, don't worry about it. We're going to stay the course. So have you all been to a Champs Forum before? I see a nod or a shake, maybe not. Some of you look familiar. Let me see if I can share my screen. I think I can. Okie dokie, can you see the screen? I'm winning. All right, one small thing, this will do. Okay, so today on the team we've got Rachel, who's kindly joined us, give us a wave. Julia, who's joining us, give us a wave. I'm Sarah, Amber's here and Eileen's here. We're going to trot through some of these things. We've already lost a bit of time, so do forgive us. We're going to have a quick roll through. We're going to do welcome and introduction, quick overview of Champs. We're going to do an update, which I've got some data which is absolutely hot off the press. It got released at 3 o'clock today. Rachel has kindly joined us to talk about some of the back to school things. If we've got time, we'll do the quiz and talk about the mission, but we will be finishing on time at 5:30. I know that you've all got things to do. So without any further ado, now I would say please stay on mute unless speaking, but this is a perfectly formed small group. So if you do have a question, pipe up. I'm going to make an exception to the rule this time because there are so few of us. If the signal's poor, we might disable your video. And if you have any questions, post them in the chat. Amber, Eileen and Julia are poised to answer them and give you the best answers that we possibly can. And apart from that, be nice, no fighting generally, but we never get that on Champs. You guys are fabulous. So if you have a question, you can raise it in the chat box, as you can see here. So if you've not been before, what are we asking you to do? Well, we know that the most credible source for most people are their friends, are their family, are their workmates and other people in their lives. So the idea is that the public health team, Torbay Council and all of its staff work really closely with NHS partners. And we communicate these messages to you in the hope that you talk to your friends, your family, your neighbours, your colleagues, and they in turn speak to theirs. So it's as simple as that. It's a really simple idea. Your job, if you like, is to come here, learn about the facts, and share that credible information with others and support other people to find that right information as well. Any questions? All right. Without any further ado then. So, quick one. In case you didn't know, champions perform a really, really important role. One of the things that you've done most recently is you contributed to a report done by the Clinical Commissioning Group. And by champions contributing to this, you've directly helped to understand how local people view vaccinations and how we can work with those who are perhaps hesitating a little bit and taking their offer up. As role models, the input that you've put in has meant that the campaigns and plans are underway, and they're going to be tailored for our communities in Torbay, Devon and Plymouth. So we just wanted to say thank you. Your role is really important, and we continue to value what you do. Every little thing you do, every conversation you have, every post you share, every survey you fill in, it really matters, and we are genuinely very grateful. Okie dokie. Quick trot through the numbers, as it were. And Julia, do pipe up with any insights that you have from your corner of the world, please. So these are the new stats. We had our update on this, as I said, come through earlier today. And the number of cases in Torbay, as you can see, are falling greatly. They are 16% of the rates that we had at the start of January. So that small little pink coronavirus of 51 is what we're looking at, as opposed to 315 at the start of January. So we are doing remarkably well in Torbay. This is the data ending 7th of March, and this is the most up-to-date data that we're able to share. There has been a small rise in the last week due to a care home outbreak, and almost half of the cases in the last 7 days relate to this one outbreak in a care home. We won't be telling you which care home, I don't know, and also it's not helpful to tell you, but we do know that these small things continue to happen. So we'll be reiterating the kind of same old messages, but coronavirus definitely hasn't gone away. In terms of our local cases here in Torbay, those aged under 60 and over have consistently had lower case rates than those under 60, which again is fantastic news. We're still seeing that the highest rates are amongst the working populations of Torbay. But again, as I said, the drivers for this at the moment tend to be care home outbreak and staff and residents. How do we compare? Pretty well, actually. We're doing all right. When we look at our neighbours, we calculate this per 100,000, so it's not absolute numbers. So we can make a comparison. We are closing the gap, you know, we're very much in line with our friends and neighbours in the southwest, and we are amongst the lowest in the country. To the slightly sort of sadder hospitalisations aspects, the total beds occupied by confirmed COVID-19 patients at the hospital in Torbay looks a bit like this. So 2nd of February, we had 35 beds. And we take that right down to the 2nd of March. Again, I appreciate there's a bit of a lag here, but there have been 10 confirmed COVID-19 patients at the hospital. And this does include non-Torbay residents. So they may be from Newton Abbot or, you know, kind of surrounding area. But we are seeing a decline in the number of beds that are being taken up by COVID-19 patients.
And it's almost nothing at the moment. So it's steadily carried on going down, which is really great.
Yeah, really good. In terms of COVID deaths, there have been more COVID-related deaths in the period since October than the first wave from March until June last year. So we have seen more deaths in Torbay since autumn last year, and that's been terribly sad. And I think we're really kind of starting to understand as a community what grief feels like for so many people and grieving under such circumstances. So we're not insensitive to that reality. The deaths lag significantly behind cases. So if we're seeing fewer cases, we hope to see fewer deaths. So it's going in the right direction, but we do acknowledge that it's been a really rough winter for lots of us. Slightly better news in terms of COVID vaccinations. Again, this is the very hot off the press news. 94% of our 65 and over population have been vaccinated in Torbay, which is, I think, a real, yeah, it's something to be celebrated, to be honest. We're starting with the second vaccinations. Lots of people are having second vaccinations now, and we've started with gusto with the under 65s. I'm lucky to count myself in the under 65s, and I cannot wait to get my letter, I must say. But in total, we've seen nearly 20 million people in England receive their first vaccination dose, which is nearly 43% of the English adult population. English adult population. So we're doing well in Torbay, and we're doing well nationally at rolling out the vaccinations. Something that is starting to emerge, and we know is on your mind quite a lot, is about the waiting times for other NHS treatments that are needed. And this graph shows the percentage of patients who are waiting more than 18 weeks to start treatment within Devon Clinical Commissioning Group area. And that means Torbay, Plymouth and Devon, it's all together. So as we can see, this peaked in July 2020, where half of patients had waited 18 weeks or more to start treatment. The numbers are particularly high amongst trauma and orthopaedic patients. And one of the explanations for this is that with issues like orthopedics, treatments enhance life, but they're not life-threatening. And therefore, they haven't been prioritised in terms of life-threatening conditions. We know it's not ideal. It's not ideal for me or my family or you or your families, is it? But I think we can understand why it is the way it is. And I hope you can help us to communicate that. Any questions? I can't see the chat, so I'm relying on others to be able to kind of let me know if there is.
No questions on
No
the
questions.
data. No.
Great. We're going to roll on. Guess what? Rachel, it's your turn. You can be Chris Whitty and I'll be your number puncher. You tell me when you want the next slide, okay?
Okay, thank you, Sarah, and thank you for the opportunity to come and meet everybody this evening. And I recognise some faces. I think you're from the education community, so great to see some people here who will probably know more than I do in terms of actually some of the logistics of issuing testing this week. I think there couldn't have been a better time to invite me to a COVID Champions week than this week, where we have seen the majority of our children and young people go back to school, which is just fantastic news. And on Monday, we had over 97% of those children eligible to go to school were able to attend and got to school on that day, which is brilliant news. And that was across our primary sector and our secondary sector. Wanted to really say that our early years sector has always been open, but some families haven't chosen to use early years provision during this lockdown, but also we're seeing a gradual return to the early years sector now that people the world is opening up a little bit as well. So really, really great news to celebrate, I think, in terms of our schools and what is happening. I just wanted to give you a bit of a context really about the journey we've been on. So if I can move to the next one, Sarah. I think it's really important as champions that we never use the word closure in terms of schools, because you probably hear that schools, the government will talk about school closures. Schools have never ever actually closed throughout this pandemic. They've just limited the amount of children at any one time that can attend based on what's happening with the virus. That hasn't been because schools aren't safe places for children and children to be, or young people to be. It's been because of the impact that having schools open has on the wider transmission rates for all. Okay, so I think that's really, really key. The government really, really are focused on our schools being open. They are safe environments. Very, very few young people get very, very ill with COVID. It's safe for them to be there, but obviously the impact of, for us, 22,000 children going out and about on a day-to-day basis obviously does enhance the risk of the virus and the transmission. So we've really been on a journey for the whole year. We were the first local authority in the whole country to have a young person with COVID, the first paediatric case in England. And I think it got us off to a really, really quick start of understanding how to look after and keep children safe in our area. So that happened back in the start of March last year in 2020. Very promptly, our first case was followed by the government asking our schools to be only partially opened, and that happened for quite a long period of time where not everybody could attend. And then we went through a phase where everybody, or the majority of young people, could be in school, and that was in the autumn. And then we went back to our second lockdown in the winter period, where it's only been for critical workers and key workers, and we had approximately 24% of our school population able to attend at that time. Obviously, this week has been the launch and everybody getting back to school. And what I wanted to say to the COVID champions really is most children have returned, and they've been returned skipping to school, I would suggest, this week, and most people and families have really wanted that return, and that's been great to see. To make that return happen has been a phenomenal event, and particularly in our secondary sector as well. And I want to talk about testing as part of the reopening plans. If you could move on, Sarah, to the next one. So in terms of how schools have been able to open, schools are still having to put in quite a lot of preventative measures, and you will be quite familiar with these, and these haven't changed throughout the pandemic. And that doesn't change based on how many children attend at any one time. These preventative measures are always there, and they're always in place to help to minimise social contact and help to stop the transmission of the virus. Obviously, as more children are in school, there is less opportunities for social distancing, so the bubbles become bigger. So you hear the word bubbles, everybody taught in groups. However, the mixing of bubbles is still the biggest preventative measure, so that the transmission doesn't go from one person to another person or another year group, for example, in a large secondary school. The biggest difference for us in this week was that secondary school pupils and college pupils were asked to wear face coverings within the school building and as part of lessons where you're not able to socially distance. And I think that's really, really challenging, if I'm honest. If you're in a face covering all day long, I'm sure lots of us just pop to the shops and have it on for an hour, and it's really, really challenging, isn't it? But actually for young people to be in them all the time, that's really hard. The government are keeping that under review, and that policy will be reviewed at Easter as well. So, but I think it was put in place to help understand, I think it was the new variant as well, and to look at the transmission rates that were happening going back to school. So really pleased to report that the majority of young people have understood that, and staff within settings, and there is obviously always those that are exempt and they're never forced to wear a face mask, and it is voluntary, but we've seen really high take-ups of people wearing face coverings, which is great. Our schools obviously still have to continue with all of the normal hand and respiratory hygiene that you would expect, lots and lots of hand washing everywhere and alcohol gels and all of those things, and minimising the contact across the site through teaching in bubbles and limiting social times and lunch times all mixing together as well. And the biggest thing to focus on is keeping spaces well ventilated. And we are being sensible around that. We're asking schools to open top windows, not make sure everybody's freezing all of the time, but actually keeping ventilation as good as possible. Can I have the next one, Sarah? Is that okay? Thank you. So in terms of then what's been different about this return to school, so in the secondary sector, in our college sector, people have been, or secondary age pupils have been asked to take part in asymptomatic testing using lateral flow devices. And really pleased to report that 92% of our population has opted to take part in lateral flow testing within our secondary phases, which I think is phenomenal. And over the colleges and the secondary schools, actually we've had over 13,500 tests completed from last Thursday. So within a week, that's how many have been conducted. And some young people are already getting their second test. So people need to test twice a week with lateral flow testing. Every secondary age pupil and college student will need to test 3 times at their school or college in the assisted testing site. And then they can move to a home testing model where they'll be given kits to take home and test twice a week. As a local area, we've recommended that everybody tests on a Sunday and Wednesday evening after 6 p.m. and it almost becomes our mantra that don't forget those testing days. That's the time to test. Staff are also being asked to do testing, and that's twice weekly, and that's across early years schools and colleges, and they can test twice a week at home as well. There isn't an expectation that early years or primary age pupils will test. And that's obviously that's because the primary age pupils that rarely get poorly from COVID, and actually there'd probably be more harm in testing them and putting them through that process twice a week than there would good as well. I'd want to just say as well, out of all of those tests we've done this week, we have seen 4 lateral flow positive results. Okay, so out of the 13,500 tests, there's been 4 that have come forward with with an LFD positive. So we're not looking for loads and loads of people to come up with that positive. What we're looking for is stopping that onward transmission where we find it, and I think that's been really successful. All of those young people were tested. Their result was known before they entered the school building, so there wasn't an issue around onward transmission. The great news as well is that not only is testing available now to staff and pupils in secondary, but also parents and carers and childcare bubbles of any child or young person that attends school. So if I think this is a big message to get out there to the community. So if you're a parent or if you're part of a childcare bubble, you can now access home testing kits, and that's through the PCR testing site at Clennon Valley. You can order your test kits and go and collect them from 1:30 till 7 in the each day, and those tests then can happen at home as well. You don't collect the test from your school. The school only gives the test to the secondary age pupils. Okay, the staff get their test from schools, but parents need to go to Clennon Valley test centre to collect their kits. You can also, if you can't have access to get to the testing centre to collect your kits, you can order them online, but that's limited in its supply and they come directly from the government. But there is an option for that as well. Thank you, Sarah. So this is my final slide, and then I'll open it up to questions, because there's a perfectly formed small group, so it's a great opportunity to have a bit of a debate. But I think my key message is that I'd really like to get out to the community is we have had incidents where children and young people have come to school when they're not very well. And I think that's the biggest thing that we can stop. You know, if children and young people are not well, then they need to stay home and check that they have not got COVID-19 before entering the schools as well. And that may be that they stay home for 24 hours and actually they're a lot better and they haven't had the classic COVID symptoms. But it may be that they need a test. And I think the test is now turned around so quickly that actually it enables people to know one way or another. I think the other key is that we've also had bubbles and household members where they've got symptoms but the children have still come to school. So if any member of the household has symptoms and has COVID, they need to stay home with that person till the person's got their test, and then they can obviously go back to school once they get those test results and they are negative. A big aspect of keeping children safe as well is also the drop-off and collection points, and those points of the day where actually the bubbles are not in, if obviously they're inside in school, but actually socially distancing on your way into school is really, really important. What we do see is an awful lot of people waiting patiently in the queues outside of primary schools in particular, 2 meters apart, letting the children go in and then meeting for a little bit of a catch up around the school gates in groups and social contact. And I do get it, you know, people are desperate, aren't they, to talk to friends and see people that they haven't seen for a long time. But those periods of time probably aren't socially distanced and can be quite prolonged in their nature as people catch up and have those conversations. So that's a big plea really, is or if you're going to do that, make sure, you know, the message is stay apart as well in the community. Wear face masks when required, as I've already spoken about. And then the other key bit is young people report back to us, I've been with my friend all day, why is it not possible for me to be with my friend at social times and in the evenings and all of those things as well? And the government's message here is at the moment we are not in a position where we can have social mixing within the community. Actually, schools have been able to open as a priority, and actually we need to make sure that onward transmission doesn't happen at any other point. So we do know that children mix beyond their bubbles outside, which kind of takes the pressure, you know, takes the issue away from the bubbles in school as well. So just some real key messages there that I'd love to be able to keep pushing with the community as well, and open it up for questions.
Brilliant. Thank you, Rachel. I think I'm going to stop sharing and just open the screen up, if that's okay for a moment. I can see we've got a few extra faces, and for those of you that joined us late, can I once again apologise for the technical issues that we've had. I see you, Eileen. Can I apologise for the technical issues that we've had. They came out of the blue, we didn't expect it, and we will make sure it never happens again, but I'm sincerely very sorry for any issues that you've had in getting in. So welcome. Right, who wants to go first? Oh, me, Eileen, you've got your hand up, let's go.
First of all, Sarah, can you just
sorry,
hear me?
Hang on. Eileen, would you just hold a moment? Sorry,
Yeah.
Sorry, Nigel.
I apologise, Sarah. I'm a bit late. As long as you can hear me, that's fine. Thank you, because I've only just managed to get in.
I know, Nigel, I'm really, really sorry about
You're
that.
sacked. You're sacked.
I know. I don't expect to work another day in my life, but if I can just get through today, that'll be fine. Sorry, Nigel. I'm sorry, everyone. Eileen, you have the floor.
Thank you. One of the things that I'm a bit concerned about is I know that they're wearing masks in the secondary schools because I've got 3 grandchildren there. But one of the things that concerns me is they're wearing the same mask day in, day out, these children, and not the hygiene of the mask really needs to be put over to, you know, to explain to them to wash it at night, put it to dry in the bathroom, or, you know, try and get 2 so they can alternate them. I think we just need to educate the teenagers more about mask hygiene, basically.
Yeah, I think we haven't focused on that in our comms at all, actually, Eileen. So I think that's a really, really good point, and we can certainly do that. So yeah, that's a really great idea. Thank you.
Fabulous.
Nice if the schools had their own masks, maybe. I don't know, I've seen lots of companies. I was watching the rugby the other day and the Welsh team had their own masks. I thought that was really smart.
Yeah,
not that they wore them either, but anyway.
In our school, we are trying to say to them, make sure you keep it clean, make sure if you've got the disposable ones, you bring a fresh one in. So we are, as a school, trying to say to them, don't forget.
I think it's fair to say, Letitia, that the DfE did provide a few masks to schools as well, didn't they?
Yeah, we've handed out hundreds over the lockdown when they've been coming in and oh, I haven't got a mask, miss, right? Out there goes the mask. Make sure you bring one in. Make sure you don't use that one again tomorrow. And so we are, we are as a school pushing that they've got to make sure that they keep a clean mask, and it's not just dropping it on the floor. They go to pick it back up and we're like, no, we'll get you a fresh one. So as a school, we are doing things.
Good.
Okay. Were there any? Oh, Julia, hi there. What's your question? Do unmute. Julia, we can't hear you. There we are.
Yeah, I'm from an early years setting. Just wanted a quick question. We've had a couple of emails by the early years team over the last week regarding the testing for staff. I did send an email 3 or 4 days ago to the community testing link because it said if we were a staff team under 50, which we are, we're only a team of 6, then we'd need to complete a risk assessment and we'd need a template from that. I haven't actually heard back from them, but we've also now had a delivery today of 8 testing kits which will cover our staff, which sort of fits in line with the email we had a day or so ago. So I'm presuming then they're the kits for us. Would we be getting the risk assessment template from the community testing? I wasn't sure what that was.
So I can pick that up, Julia, because there's been a DfE communication that's just come out this afternoon, Julia.
That's right. I'm just reading that now.
Yeah. So the government have now issued your testing kits directly to send your provisions, which is great.
Yes.
And with that testing kit, there's also a link to a platform now that's got the handbook and all the instructions in.
Okay.
And in there, it also talks about the risk assessments and what you need to put in them. So on that platform's got everything you need.
So disregard the previous one to get them by community testing, because we weren't sure when they arrived today. We were a bit confused. Well, Jane Jones anyway, and she was like, are these for the parents to have if they can't get to Glenham Valley sites? So they are actually, and then I've just seen this email now, I've got it that says that we'll be receiving them today. So, but we don't start, it says we don't start testing till week beginning the 22nd of March.
That's
Is that
right.
correct?
Yes.
Yeah.
Okay. So we put in place the access to the community testing because we knew that the early years deliveries was going to be delayed until the 21st or 22nd of March. So it's great that you've received them ahead of that schedule.
Yeah,
So
that's fine. So the link for the handbook and instructions, that will be in this email that we've just received, will it?
Yes. Yes.
Okay, brilliant. Thank you.
Good stuff. Sounds like everybody's working very hard to get everybody the right tests on time, and when they arrive on early, I can see why it's a bit confusing, but at least I'm glad you've got some tests. Was there any other questions, or was there anything in the chat? Tori, hi, welcome. How are you?
Hi, can you hear me? Because sometimes my computer's not very good. Yeah,
we can hear you.
We got an email today from school, from NHS Test and Trace, saying that it's best to do the test in the morning. Is that true, or yeah?
Julia.
It's a new one of me. I haven't heard anything about it being better at any particular time of day. So I saw that in the chat and I thought, well, where did that come from?
Yeah, it was just an email, NHS Test and Trace leaflet that's been forwarded on.
Well, if you've got a link,
Yep.
I'll follow that one up. But it's not something I've ever heard in any other source. We've never been advised to do it at certain times of day for others. So we'll be interested to look into it, and we'll come back if there's anything in that, but I've not heard it.
All right, thank you.
Thanks.
I think we're really keen to adopt the Sunday evening and Wednesday evening part, because we can see, especially secondary school pupils, getting up an hour earlier before going to school to then have to do their tests, wait for their results, being quite a challenge. So actually we were thinking that the evening testing is more likely to get a good take up, we hope.
Definitely.
Yes.
That makes sense.
I think from our perspective, it's more about people conducting the tests rather than when, really. I think that's the key.
Okay.
I just could I just pick up on a few extra bits other than testing, if that's okay. So I just in terms of then how we're going to help and support children beyond school as well. So in the Easter holidays, the council have committed to continue giving vouchers to children and families that are most in need of preschool meals and access to food as well. So that's a really strong message to get out to families. So families would have received those at Christmas and February half term, and we're going to continue that for the Easter holiday as well. And you may have heard lots about summer schools and catch-up programs for summer and things. We do not know any detail at this moment in time. So we've got lots of parents that are asking schools and telephoning into the council and saying, you know, what's that going to look like? We haven't yet got that information. As soon as we get it, we'll obviously make sure we communicate that. But we're without that, but there's been lots of announcements around it. So we'll make sure that comes back.
That's really helpful. Thank you, Rachel. Julia, what have you got? Speak up. No, I'm sorry, you're still on mute, Julia. There you go.
Hello.
Yeah, we've got you now.
Just to pick up what was mentioned a couple of minutes ago about when to test, and Rachel was saying about the Sunday evening and Wednesday evening. On this, the government guidelines that we've got here, it says about carrying it out twice a week, preferably in the morning. But are you saying, Rachel, that we should stick to the 2 evenings, really?
That's what we've done for secondary age pupils, Julia. I guess it's up to staff when they test. I guess the key bit is the tests are 3 to 4 days apart, so it's making sure people get into a sequence. We just felt if probably if you're doing family testing, you may all want to do it together rather than have on different nights and things like that. So but obviously we just thought we could promote testing on those 2 days if everybody did it on the same days.
Makes sense. Okay, good.
Probably not such a rush in the evenings either, is it? Trying to get testing in the morning done.
Yeah, I think it's setting people up to have a bit of a stressful morning if you ask parents to do children to do that in the morning. Let's plan to succeed.
They don't always wait. We had one that tested and came in and then had to come and collect their child. So Yes.
Yeah.
Yes.
Okay, yeah,
So yeah, I think probably evenings are better.
good.
What I would want to say is the young people have reported that the testing isn't a stressful experience, which I think has been great. So they haven't really found that really challenging either. And we were a little bit worried about that, but most people have accessed that testing and haven't found it very stressful either, which has been great. So
That's really important, isn't it? Really important. I know that our friend Helen has joined us from the 0 to 19 partnership. And Helen, I didn't know if you wanted an opportunity to talk about other services that are available to children, young people and families in Torbay at the moment. Since you're here, might as well ask you to
Absolutely, happy to share. Thank you, Sarah. Yes. So as Sarah said, I'm Helen Hallam. I'm the project manager for the 0 to 19 Torbay partnership. And for those of you that don't know what the partnership is about, it's a partnership between health visiting, school nursing, children's society, checkpoint services for young people, and Action for Children, children's centres for children and families under 5. So throughout the COVID period, we have been delivering a range of services, particularly our health visiting and school nursing team have continued to sort of see people and families, particularly sort of, you know, those that the main sort of contacts points they need to have with families, sort of when a baby, you know, newborn baby, and at various points through the baby's first years of life. So initially we switched to kind of being virtual, but now we've kind of offering people either a virtual or a face-to-face, socially distanced, with all the precautions in place of face coverings, you know, sometimes meeting outdoors, all of those kind of things. So they're very compliant. And since kind of end of last year, really, we've also been providing some very small socially distanced groups for families that we are, you know, more concerned about and more at risk of, say, postnatal depression if they've got a new baby and things. So things like baby massage and child development groups where, you know, where there's an identified need really to support those families. So we've been kind of carrying on, and we've also been doing, we provide family support through the children's centres, and the checkpoint services provide a whole range of support for young people. I guess one thing I particularly wanted to pick up on was that part of the service we provide wellbeing service for young people through Checkpoint and working with Southwest Family Values, and more latterly sort of with Young Devon. So there's a wellbeing service for kind of 8 to 18-year-olds for low-level emotional mental health concerns. So if you're coming across young people or anything that's you know, anxious about going back into school, things like you know, could be, you know, just not just anxiety around school, but, you know, it's the meeting friends again. They've kind of felt very isolated. We know that some young people's kind of eating habits might have gone sort of slightly wonky over the sort of COVID period. It's just getting out of any of that routine stuff. So we do have a wellbeing service that anybody can refer into. A young person can themselves, a parent, yourselves as a school, or, you know, anybody that knows somebody that might be struggling. But I stress it is low level. It's not higher level stuff that child and adolescent mental health might deal with. It is just that very, very low level things. And to refer into the service, you can either contact Southwest Family Values Checkpoint, or you can just contact us at 0 to 19. If you put in 0 to 19 into Google, we should come up as there's a website where you can kind of get all our phone numbers, email addresses, everything like that, or you can find us on social media, just about every platform. So put in 0 to 19 and you can just message us that way, and we can ping you a referral form or anything that you want really. The website has got loads of information about all our services and things, and so we are kind of carrying on. You know, we are still providing you know, that support and that thing to everybody. Sorry, I was just reading Tori's message.
Question.
Yeah, I'll pick that one up in a minute. So we are still there, and we are still providing those services because we know that you know, people still need that support, and we're trying to sort of carry on doing that sort of preventative stuff. I think for us, a lot of people in the early days were like, I need to get my baby weighed. I mean, that's a classic sort of for families, you know, just, you know, parents, new parents, just to make sure baby's sort of gaining weight. We have provided limited child health clinics right the way through since day one. appointment based rather than just sort of a drop-in kind of thing, just so we can control the numbers. Our staff they are tested twice a week, so they have been doing that for quite a long time. So you know, we've had a number of staff that have tested positive that we've had to isolate and everything else. So it is good to do the testing twice a week, so that you know, we're not risking sort of spreading that transmission around, really. Tori, your question around vaccines and pregnant people. Oh, thank you, Rachel, for putting our website in the chat. I don't know. Pregnancy isn't our, you know, we're after pregnancy, if you like. So I'm sorry, I can't answer that one.
Julia Chisnell, is this one for you, if that's
I
all right,
know, I'm
please?
just double checking. Originally it said that there was no known risk associated with pregnancy, but they just hadn't got any additional data to say it was fine. And I'm just trying to see if they checked that, if they changed that to say that they should go ahead. So I should know off the top of my head. I'm just checking the green book, which is the vaccination guidebook.
Okay.
So shall I come back to you in a bit? I'll just read through the
Right,
chat and I'll come back to you a bit later and see what it says.
I suppose the other thing for us as a service, as you know, restrictions are kind of easing a little bit, we are planning, you know, a lot more things to sort of catch up on some of the other stuff. We will. Actually, one important thing, if you are working with any, or you know, you will know children, young people, and families. We brought in through the clinical commissioning group last year, Solihull online parenting courses. So there's antenatal courses online, and there's parenting for new baby, for toddler, for parents of teenagers, understanding your teenager's brain, and also for the teenagers themselves, understanding their brain. And then there's parents of children with additional needs, and a number of courses, and they're all free, and you can access them from our website. There's a link there that you just click on, and they just put in a code, which again is on our website. The code is just Tamar. Anybody can access those courses. So, and as we kind of, you know, start opening up a little bit more, we are planning face-to-face antenatal courses and parenting courses and things like that. So, and when restrictions are eased even more, we are planning on putting a whole range of universal services in there to try and play catch up, particularly on those families with under twos that have missed out on that, you know, babies on socialization skills, communicating, turn taking, all of that stuff that they haven't had because they might not have met another baby for the last 12 months. And they've seen adults, you know, the only adults they've seen apart from their own parents is probably wearing a mask. So there's lots of kind of things that we're anticipating that's going to come out, you know, as a result of this, that's yet to be seen, sort of thing.
That's wonderful. Sorry.
yeah. No, so we are planning all that sort of universal, you know, a lot more of that than we would have done, just so that we can pick up on that before it's, you know, just try and play catch up with it, really. But so just kind of bear in mind is the mental health and wellbeing kind of support there for, you know, 8 to 18. It's out there, and as a service, we're still carrying on, and website and all our information about what we do is just, let's say, Google 0 to 19 Torbay, and you'll find us.
That's fantastic. What a fabulous update, and how many great resources are we lucky enough to have in Torbay. Thank you, Helen. Now, I'm very aware that we have 3 minutes left. This is by far the shortest forum ever, but I like to think it's about quality, and that this has been one of our most quality forums yet. Are there any final questions from you, our champions, please?
The Green Book says,
thanks, Juliet, she's back.
The Green Book says that there's no known harm with having the vaccine, but currently they hadn't done sufficient trials to recommend it routinely. But if there's a risk assessment, so if someone's pregnant and they have a risk condition or a particular risk of exposure, then they would consider doing a vaccine. So no known harm, but I think they weren't generally on the list as a routine yet.
Okay. It makes sense, doesn't it? Given that the vaccine was developed so quickly, to trial it on pregnant people would have taken a lot longer. And I'm sure it's happening right now as we speak, but they'll let us know as soon as there's a bit more knowledge that it's a safe thing to do.
And it's not a live vaccine, so that suggests that it's safe. Yeah.
Okay. Well, Rachel and Helen, I hope we can invite you back for the finale, if you like, of kind of returning to normal, and if you like, the end of term but back to normal, something along those lines. champs, I think you're kind of done with questions or comments. Last word. Okay, all right, go on. In which case, I think all that there is left to say really is thank you for joining us. We've got a couple of quick key messages. So testing staff and students weekly helps to pick up the 1 in 3 people who show no symptoms. All of the tests work well as part of a combination approach alongside hands, face, space and vaccinations. No one bit is ever going to do this completely. We need all parts to keep working. It's a bit like a watch, you know, an old watch though, with lots of moving parts. We need each bit to be nicely oiled and working together. Self-isolation for close contacts is still essential. And please keep to the rules. We're really so close, but we're not there yet. So let's not lose the gains that we've all made as a community. There is more, there's always more, but actually I think we're probably done, and I'm not going to overcook it. For those of you who came last time, you might know that there was a quiz. Nigel, in fact, that there's a quiz because I sent him the questions yesterday. I will ask the quiz questions next time. There will be more interactive polls and things for you to do, but something had to go after our unfortunate technical glitch. So unfortunately, it's been the quiz questions. Sorry folks, but just come next time, there'll be more to do. Oh, thank you, Rachel. Rachel says, thank you, I'd love to come back. That's wonderful. All right, Julia, just know any last words from you?
What, like hand, space, don't forget them. I think lots of good positive news today, lots of really good things about vaccine, about schools and so on. And I think if we just keep going with our old messages of hand, space as well, we're going to get there. It's all looking quite positive, isn't it?
Right. Thank you. And Helen and Rachel, any final words from you? No, I think Rachel's just said it in the chat, which is thank you. Okay. Apologies again, but yeah, thank you very much, everyone. I'm going to close the forum there. Thank you so much for coming. Thank you for bearing with us. And if there's anything you need, please use the email and keep sharing, keep putting the right information out there. You're really making a difference. We're going to do it. It's going to be all right. But thank you for your help, everyone. Have a great evening, and I'll let you all sign off in your own way. Thank you. Bye, everyone.